Hey guys, this is Dr. Tom Agopian with Peachtree Plastic Surgery. I wanted to go through a couple more Reddit questions. It was pretty fun last time. There's some interesting ones going on right now, so I figured we could talk a little bit about them. This first question comes from you/nosy Hanozy. It's a funny username. He asked, rhinoplasty by a plastic surgeon and not an ENT. Have any of you guys gone with someone who wasn't an ENT? Was your breathing compromised? So a little bit about rhinoplasty and who's qualified to do a rhinoplasty. There are basically two types of people, two certifications that are qualified to do a rhinoplasty. One is the plastic surgeons, board certified or board eligible by the American Board of Plastic Surgery. The second are ENT facial plastic surgeons who are ENTs that have gone through a one-year fellowship in plastic surgery of the face. They are board certified by, I think it's the American Board of Facial Plastic and Reconstructive Surgery, and they are also legitimately and well trained to do rhinoplasties. What this person is asking is, has anybody actually gone to a plastic surgeon? It's kind of a silly question, but a lot of rhinoplasties now are done by the facial plastic surgeons. What's the difference? There really isn't any. We are all very well trained to do it. There's no evidence one way or another saying that one group of people does it better than anyone else. I think the thing that matters the most is how much experience the person has, and do you like their before and after photos? That kind of thing. Do you get a good vibe from them when you meet with them for consult? Do they do noses like yours? Can they show you lots of before and after photos? And what does their reviews look like? I don't really particularly like reviews as a method of reviewing a surgeon, but if someone has a lot of negative reviews, that might be a sign that it's a bad idea. When you go for a consult, ask them to show you a nose that looks like yours. Ask them how frequently they perform this procedure, and they should be able to give you an answer to all these questions. You could even ask them, how often do you have to revise a nose? And for something like a rhinoplasty, a 10% revision rate, or 1 out of every 10 patients having to have a revision, is pretty common. So, but one group is no better than the other group to do it, both equally qualified to do that. All right, another question. This one comes from you/bodymodthrowaway819. So basically a throwaway Reddit account. Too young for breast augmentation, 18-year-old female. Hey y'all, I'm 18 and ever since I was 16 I've always wanted to have a larger bust. My breasts look quite small. They're somewhat saggy because she's lost a lot of weight. She went from 200 to 135, which is not easy to do. Good for her. She doesn't want to have a breast augmentation until she's 19 because of her personal situation, but she is asking any advice or if she should wait for a breast augmentation. So in the United States, the FDA approved indication for breast augmentation for saline implants is at age 18, and it's 22 for silicone implants. So if she did get an augmentation right now, she would probably get saline implants. Some people are willing to put silicone implants in people under the age of 22, but that can be few and far between. Is it too early at age 18? Not for some people. For some people it might be. It kind of depends on the person. It depends on where they are in their life and what their life structure looks like and basically why they're doing it. At age 18, they're adults. They're able to make their own decisions for their body as they should, but it's something that as a plastic surgeon, I like to look at the motivation behind why somebody who is very young is undergoing that procedure, wants to undergo that procedure. I am not opposed to performing it on an 18-year-old at all. I just want to make sure that they're making a decision that is in their best interest, or that they have their own best interest in mind when they make that decision, and they're making it for them and not for somebody else. That's kind of the big thing. When people make these decisions about their body to impress somebody else, it's usually a bad sign that they're not going to be happy with the result. Plastic surgery is about making yourself feel more confident in your own skin, and when you do it for somebody else, that doesn't usually end well. And you end up being pretty unhappy about your decision most of the time. All right, here's another one. This is a really common question. I've actually been getting, a lot in the last couple of days. Swelling and hard lumps after liposuction. This is by you/honeybun1213. I recently got liposuction in my stomach, flanks, back, and inner thighs about 3 weeks post-op. Now that's key, the 3-week thing. I'll get back to that in a minute. I've gone once a week since surgery for a professional LDM, which is a lymphatic drainage massage, and began self-massaging this week. However, I'm noticing that I have a few harder lumps and that my lower when self-massaging. I'm not sure what they mean there. I lay under my vibrating heat pad for 15 minutes, massage for another 15 minutes, blah, blah, blah. So he's doing a lot of massage. Is this normal? I'm worried the lumps in my lower abdomen won't smooth out with time. I wasn't able to compress properly for the first week and a half. And now I am. I know this is a process. I know I'm worried, but I'm worried that I messed up by not compressing. So typically after liposuction, we will have people wear compression garments, and plastic surgeons all do this differently. So everyone's surgeon has their own way of doing it. But essentially, we all provide some form of compression to the area that we liposuctioned. When you liposuction, you're removing the fat. The skin overlying it can be a little flimsy, and then we create an area, a space where the fat used to be that we've now removed. If you don't compress it, what can happen is that area can fill with fluid, and you get what's called a seroma, which is a fluid collection where you did liposuction. It's kind of it's not a terrible complication, but it's a complication that can happen that is usually prevented by wearing nice tight compression garments pretty much all the time for at least 2 weeks and sometimes a lot longer. So what happens if you don't wear those? Well, a lot of times nothing. It's fine, but you can get a fluid collection or you can get increased swelling that wouldn't otherwise be there had you worn the compression. So it's definitely a good thing to do. Now, this patient is 3 weeks post-op from liposuction, and he's noticing bumps. That is super common and actually kind of expected. It's not really a complication of anything. It's expected. It's part of the wound healing process. So we create a wound where the fat used to be because we're injuring it with a big metal tube, a big metal cannula, and we're removing the fat. And part of the healing process is to lay down scar. That's kind of how it works. And sometimes in about the 3 to 6 week mark, you start to feel these big thick nodules of scar that are being formed. That's one of the healing processes, which is this called a proliferative phase of healing that happens between 2 weeks and 6 weeks. And that's where those cells called fibroblasts are laying down tons and tons of collagen. And then over the next 2 years, that collagen gradually gets replaced in a process called remodeling with normal collagen or normal skin collagen, type 1 collagen we call it. And this process takes a long time, but that's why we always say, give it time, it'll smooth out and settle. Scars do the same thing. They soften over time. A lot of times they get less noticeable as they heal, and that's the process of remodeling. So this patient, hard lumps after liposuction, they will get better. I mean, I can predict that they will get better as long as he is a normal human with normal healing, which I've never met somebody who wasn't. So just needs a little bit more time. Now, he talks about doing massage. Lymphatic massage, there's very little evidence for the use of lymphatic massage in liposuction. However, there's great evidence for the use of lymphatic massage with lymphedema. It's a different process, but we take that knowledge that we learned in the lymphedema patients and apply it to our liposuction patients, thinking that it will improve the swelling and possibly improve the fibrosis or the lumps that this patient's feeling. Patients really like it. They tell me it helps. They notice a big difference immediately after in their swelling. So yeah, I think it's helpful, and I think most plastic surgeons also think it's helpful. Some require it afterwards. Some advise it. I recommend it for people, and everybody gets at least one session after they follow up with me for liposuction. But yeah, that's what they're talking about. And there's a thought that massaging these fibrotic lumps can help break them up a little bit sooner. There is some evidence for that in the burn population. Patients who get big burns, they form these really thick, ropey scars in the burned areas as they heal. And one of the things we have them do is we have them do something called scar massage, which is where you press really hard on these thick, ropey scars. It kind of hurts. You have to do it pretty aggressively, but if you do it right, you'll break apart the scar collagen. It can soften the scar. It actually makes a really big difference in these patients. I mean, you do that in conjunction with a compressive garment, you can get really thick, ropey scars to calm down and settle very nicely. And so we take that knowledge in the burn population and for other scarring, and we apply it to liposuction because it's all a similar process. You guys want to do a botched surgery question? Let's do that. Oh, the r/botched surgery subreddit is just a ridiculous place. I always find it so funny. The botched surgery subreddit has 459,000 members, but the plastic surgery subreddit has 71,000, which I think tells you something about us as we really like to see shocking and very captivating things. Unfortunately, it kind of gives plastic surgeons a reputation, or maybe not plastic surgeons, but I don't think it's overall very good for plastic surgeons. Because really, we're not trying to sensationalize people's desire to look better or to be more confident in their own skin. Okay, so we'll look at this post. This is kind of interesting. It's called Burger Butt, like a hamburger. This is by you/Buildip I don't even know, u/bio something. Okay. Anyway, it's by some user. Posts a simple photo. In this photograph, it's a young woman who has clearly had a butt augmentation with fat, most likely, sometimes implants, and she's laying in the water on the beach, and she has a very large buttock. So this photo is, this can happen. So this is probably somebody who had a BBL and had a very high volume of fat placed in it. And it's a very long and kind of oversized look. It's hard to say whether this is what this actually is, what this looks like when she's standing up, but it's definitely a look that um, it's not a very natural looking buttock, if you ask me, and I think that that's why it's on this subreddit. Um, yeah, this is somebody who just, it's too much. She's not nearly big enough to have that high of volume fat transferred into her buttock. And I don't know if this could be a look that she's going for, and it is definitely a look that people go for, and that's okay. But if it's not, you know, it's not a very natural looking butt. I agree. Does it look like a hamburger? I don't know. Not really. That's a little dramatic, but yeah, it's a lot of fat to put in the butt. But I hope she's happy with it, and it doesn't really matter what someone on botched surgery thinks, or even what I think. It just matters what she thinks. If she's happy, then go for it. She looks pretty confident in this photo. It looks like somebody was not just snapping a photo of her. Anyway, this is fun. If you guys like this, please, and you're watching this on YouTube, please click the like and subscribe button. It helps me out, and you can be one of the 100 people that have subscribed to me. It's great as I start my career as a plastic surgeon. Otherwise, if you want to follow me on Instagram, that's my main hub for everything. I'm at Dr. Thomas Hagopian. And that's where I post all my photos. That's where I kind of communicate every day. It's the central hub for everything plastic surgery in my world. Yeah, if you guys have any questions, please feel free to reach out to me. You can reach out to me on Instagram, send me a DM. I do them on my own social media, so you'll be communicating directly with me. You can also go to Reddit and send me a question there. I answer questions all day long on Reddit. I am Dr. Tom PS. I frequent the r/plastic surgery and the r/reduction subforums. Okay, take care.